Good afternoon, everyone. Myself, Dr. Sugandha Agarwal from the Department of Public Health Dentistry will be taking a lecture on primary health care. Introduction. Primary health care is a key force in promoting and protecting the health of population. So it concluded at the World Health Organization Conference in Primary Health Care held at Alma Ata in the USSR in 1978. Concept of primary health care. Primary health care was featured within the declaration as a critical strategy for achieving better health for more of the world's population. Healthcare system should be reoriented away from an emphasis on curative interventions to an emphasis on disease prevention and health promotion. And services should be moved from institution to the community. Primary health care was also seen to pursue a number of activities like education about prevailing health problems, promotion of food supply and proper nutrition, adequate supply of safe water and basic sanitation, maternal and child health care, including family planning, immunization against the major infectious disease, prevention and control locally endemic disease, appropriate treatment of common disease and injuries, and provision of essential drugs. Five core principles of PHC are equitable community, a focus on prevention, appropriate technology, multi-sectoral approach given by Walton Wagon in 1981. So what is equitable distribution? Inequity refers to differences that are unnecessary, unavoidable, and that are unfair and unjust. We can never achieve a situation where everyone has the same level of oral health or suffer the same degree of disease. But the crucial tests are whether people have choices and options. Equity in our roles as professionals is therefore concerned with creating opportunities for everyone to achieve oral health is a part by bringing differential in disease. It would seem logical that disadvantaged people have poorer oral health. So they established link with the primary school in their catchment areas and initiate small-scale oral health programs. Thus, more than 60% of the health centers in the region of Peru now have health workers trained in emergencies. Community involvement, treatment strategies of public health intervention, no matter how well designed are meaningless if they do not match local conditions. Even if all the components of bicycles are in place, but without the participation of the people in the community, the level driving it forward and energizing it, nothing will happen. So this is a community participation, energy moving PHC forward. Shows a diagram shows about the prevention and the promotion. They are the two critical points. First, good dental health care needs to be seen as a good care for all people. Second, concern who define those needs and who decides both what will to be done and how. Effectively engaging with people, community help to ensure that our actions are relevant. It helps us to interpret the well-being. Community health involves deal with the people on their own terms. Focus on prevention and health promotion. Increasingly, the meaning of prevention has become compressed to be another services like placement of sealant, applying fluoride, and provide dental education. We need to expand our understanding of prevention beyond microbes, plaque, and changing behavior. When one examines more deeply the cause of oral health problem, one realizes that causes are related to social determinants. Not being is control has been long recognized as a risk factor for disease. Personal community empowerment is what is required for real oral health changes in occur. Appropriate technology, the singular treatment strategies emphasized in the dental school of the world require equipment that are often worth thousands of dollars. Meanwhile, an unmodified transfer of science and technology to poor social societies burdens their system with an unbearable inflow of materials that are difficult to control and maintain. ART is less threatening treatment for caries at an early stage and at low cost for it can provide when where electricity is not available. The intention here is not to produce or use cheap second-class material and equipment. Rather, the objective is helping dental worker cope with economic and technological constraints. Multi-sectorial approach, a major reason for the lack of success of many oral health programs is the fact that they operate in isolation, separate from the general healthcare structure. Adopting a common risk health factor approach can impact in several diseases at lower cost than disease-specific approaches. For instance, unhealthy diets affects the incidence of heart disease and cancer as well as oral disease. So reducing intakes of sugar, fat, and salt together with increasing intake of complex carbohydrates, fruits, and vegetables. There is a need to adopt a population rather than a high-risk group strategy. Individual care is important, but if oral health is to improve, more attention must be given to the population. For examples for this, some policies are there increasing the availability of the fluoride, promoting sugar-reduced products, establishing codes of the practice for advertisements. Oral health is a part of general health. It is not difficult to interest primary care professions promoting oral health within the context of overall good health or well-being. Dental disease can prejudice the general health, causing acute pain, distress, and lost night's sleep for the suffering people. As eating becomes uncomfortable, chronic pain can affect a person's diet and nutrition. Dental disease can result in chronic sepsis, producing a bad taste and unpleasant odor. Acute infection can provoke the cellulitis, which in extreme cases may present a threat to the life. Dental treatment can be unpleasant, especially for a young child with a limited ability to cooperate and a high treatment need. A general anesthetic administered although allows extraction of teeth but is itself a traumatic experience and at worst is an unnecessary risk to life. Effect of oral health on journal health. Oral health and journal well-being are inextricably bound. Many conditions that plague the body are manifested in the mouth, thus unable to view the onset, progression, and the management of numerous systemic disease. Oral infection can have an adverse effects on other organs of the body. Oral cavity can tell of direct assaults by a broad range of systemic disorders such as diabetes, AIDS, um, Sjogren's syndrome, as well as a complication of treatments like cancer, chemotherapy, and radiations. Oral healthcare system in India. India is the largest democracy in the world, covering 1/7 of the area of the world. The healthcare in India is still under various stages of development, with vast differences between the regions and the states. There are vast differences between oral healthcare services at village level and metropolitan cities. Their dental school offer excellent tertiary care in a cost-effective manner. It is becoming a favorite tourist destination for oral dental treatment for international standards. On the other hand, even the most basic oral health education and simple intervention like pain relief, emergency care for acute infection and trauma are not available to the vast majority of population, especially in rural areas. Health of any population depends upon two major healthcare delivery systems, socioeconomic profile like socioeconomic status, literacy rate, human development index, health indicators. Healthcare delivery system based on principle of providing health for all, an integrated network of sub-centers, primary health centers, community health centers, district hospitals, and multi-specialty tertiary care hospital provide different level of care to the population. So this is a chart showing about the healthcare delivery system in India. Socio-demographic profile, India stands for 126th rank amongst the world nation as far as human development index is concerned. HTI index provide a composite measure of three dimensions: living a long and healthy life, being educated, having a decent standard of living life, income. Majority of dental service in India is provided by private dental practitioners. The oral health care have not received due to importance in India. Each PHC further has 8 to 10 sub-centers, each responsible for providing health services to distress margins and this much of the sub-centers. National Oral Health Care Program, WHO focuses attention on the oral health in 1994 and chose a theme of oral health for healthy life for World Health Day. This workshop considered the recommendation national workshop by the Bombay in India, Bombay, 1984. Development of the following materials, born in Hindi and English. So some other materials which was given in Hindi and English to educate the person and to the public and the community, like film like Kripa Muskaraiye, training manuals for health workers and school teachers, oral health ready reference sheet for healthy workers, posters for oral health awareness of the community and the children. So oral health manual for trainers of ASHA and health workers was developed by this in 2008 and 2009. So this project was entitled "And Development of Training Manual and Relevant is Material for Health Workers and Training Cascade under NRHM." So what are the golden rules imparted to ASHA workers given by WHO? Brush your teeth twice daily after waking up and before going to sleep. Always rinse mouth properly after eating. After every meal, develop a habit of not eating in between the meal. Snacks, avoid consumption of sweet and sticky food items. Eat nutritious food like rich in vitamins, fruits, vegetables, milk, and milk products. Get the routine dental checkup done by the hospitals or dental clinics at least twice a year. So raising the profile of oral health with the primary healthcare professional, the main step to involve different primary care professionals in promoting the oral health. They may have witnessed infection of pain, loss of function, loss of aesthetics, or anxiety that dental disease or its treatment can generate. Training meetings with individuals, speaking at meetings, participatory training is a key to involving different professionals group in the oral health promotion. So this is a chart which shows about the pamphlets we can make to promote, to motivate the all the community school childrens by these pamphlets. So the conclusion, primary health care is important because it is the first point of contact with the health services for the family and communities. Primary care professional can promote health through advocacy that is influencing the social and physical environment through enable which makes health choice easier and provides access to information and skills, and through mediation which can bring about coordinated actions across all sectors to improve to improve the health. Oral health is seen as a part of good health and well-being. Therefore, efforts to improve oral health will be part of common risk factor. The whole range of primary healthcare professionals can become involved in promoting oral health using a team approach. So, ultimate aim of such a strategy is to improve oral health and so contribute to the overall good health and well-being. Thank you. That's all for today's lecture about the primary healthcare.